Messages from what to expect when you're expecting that hopefully will help ease some anxiety from women who are pregnant and anxious or who are hoping to get pregnant soon and know they will be anxious pregnant ladies. Some specific concerns. Lower abdominal pressure. Don't worry. A feeling of pressure or even mild crampiness without bleeding is very common, especially in first pregnancies, and is usually a sign that everything's going right, not that something's going wrong. Chances are that sensitive body radar of yours is just picking up on some of the many dramatic changes that are taking place in your lower abdomen, where your uterus is currently located. What you're feeling may be the sensation of implantation, increased blood flow, the buildup of uterine lining, or simply your uterus beginning to grow. In other words, your first growing pains. It could also be gas pains or bowel spasms that come with constipation, which is another common pregnancy side effect. Spotting. It's definitely scary to see blood down below when you're pregnant. But what's not definite is that bleeding is a sign that something's wrong with your pregnancy. Many women, up to 1 in 4, in fact, experience some bleeding during pregnancy, and most go on to have a perfectly healthy pregnancy and baby. So if you're noticing only light spotting, similar to what you see at the beginning or end of your period, you can take a deep breath and read on for a probable and probably reassuring explanation. Implantation of the embryo. 20 to 30% of women get such spotting, which is often called implantation bleeding. This will usually occur before, or in some cases around the time that you expected your period, about 6 to 12 days after conception. It's lighter than a period and lasts anywhere from a few hours to a few days. Implantation bleeding is usually spotty and light to medium pink or light brown in color. Recent sex, an internal exam, or pap smear. During pregnancy, your cervix becomes tender and engorged with blood vessels and can occasionally get irritated during intercourse or an internal exam, resulting in some light bleeding. This type of bleeding is common and can occur at any time during your pregnancy and usually doesn't indicate a problem. Another potential cause is an infection of your vagina or cervix. If it gets inflamed, irritated, or infected, your cervix or vagina might have some light spotting. Another possibility is subchorionic bleed. I don't know if I pronounced that right. This occurs when there's an accumulation of blood under the chorion, which is the outer fetal membrane, which is next to the placenta, or between the uterus and the placenta itself. It can cause light to heavy spotting, but it doesn't always. Sometimes this is only detected during a routine ultrasound. Most subchorionic bleeds resolve on their own and do not end up being a problem for the pregnancy. General commentary about anxiety. Most expectant worriers end up worrying unnecessarily. Most pregnancies continue uneventfully and happily to term. Just about every normal pregnancy includes some cramping, some abdominal aches, or some spotting, and many include all three. While any of these symptoms can be understandably unnerving, more often than not, they're completely innocuous and often are not a sign that your pregnancy is in trouble. You should report them to your provider at your next visit or sooner if you need some professional reassurance. But the following are no cause for concern. So don't worry if you have, and then it goes into specific ones. Mild cramps, achiness, or a pulling sensation in the lower abdomen on one or both sides. Early on, this is probably related to implantation, the increased blood flow to the region, the buildup of your uterine lining. Unless cramping is severe, constant, or accompanied by significant bleeding, there's no need to worry. Another is light spotting that isn't accompanied by cramps or lower abdominal pain. As we already went over, there's lots of other reasons why spotting can occur. It also says, of course, it's not just symptoms that pregnant women worry about in early pregnancy. It can also be a lack of symptoms. Not feeling pregnant is one of the more commonly reported first trimester concerns. And that's not surprising. It's hard to feel pregnant this early on, even if you're experiencing every early pregnancy symptom in the book. It's far harder still to feel pregnant if you're relatively symptom-free. Without tangible proof yet of that baby-to-be growing inside of you, such as a swelling belly and the first flutters of movement, it's pretty easy to start wondering whether the pregnancy is going well or whether you're even still pregnant. Once again, not to worry. A lack of symptoms, such as morning sickness or breast tenderness, is not usually a sign that something's wrong. Consider yourself lucky if you're spared these and other unpleasant early pregnancy symptoms, and also consider that you might be a late bloomer. After all, since every pregnant woman experiences pregnancy symptoms differently and at different times, these and other symptoms may just be right around the corner for you. It asks, what if spotting progresses to heavier bleeding that is more similar to a period? Though this scenario is more cause for concern, especially if it's accompanied by cramps or pain in your lower abdomen, and this does warrant a more immediate call to your provider, it's still not a sign that you're inevitably miscarrying. Some women bleed, even heavily, for unknown reasons throughout their pregnancies and still deliver healthy babies. On stressing about stressing. Research shows that pregnancy isn't affected by typical stress levels. If you're able to cope well with your everyday stress, even if it's more than most other people might take on, then your baby will cope just fine too. That said, too much stress, or stress that isn't well managed, can take a toll, particularly if it continues into the second and third trimesters, which means that learning how to handle stress constructively or cutting back on it as needed should become a priority.